Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
I'm living it up.
Yay. Well, our listeners are going to live it up if they call and find out why they're in pain. We're going to talk about orthopedic pain today, musculoskeletal pain, that's joint pain, tendon pain, ligament pain, neck pain, back pain, knee pain, hip pain, arthritis pain, joint pain, muscle pain, any kind of dull aches, stiff joints. Maybe you have tendonitis, carpal tunnel, and you don't even realize it, but you have pain in those places, your wrist or knees. And our number, so you can solve the mystery, is 866-870-5752 right here at the station. That's 870-5752. When you phone the program today, you do get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. Now think about that, what that means, and give us a call if you don't know. It has 264 scientific studies, actually. And another thing you can do while you're listening is go to Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. Very cool stuff. Reminding you, we're here Saturdays at 10 a.m., again at 1 p.m., and if you'd like to call the office and just have a personalized conversation, you can call 24/7. Make appointments, 800-300-9300. That's 800-300-9300. But what we really want you to do is call the program right now so Dr. Darrow can give you some personalized attention over the radio. That number again, 866-870-5752. What do you think?
Well done, Nita.
Why, thank you.
So let me get to a question. Yeah,
okay.
Then we can explain what regenerative medicine is.
Great.
And how we can help heal the body without doing surgery. In most cases, it doesn't work every single time. I have to put out that disclaimer. And I do want to say something right off the bat here, is that I love orthopedic surgeons. So my hat's off to all you guys. I just don't like all the surgeries that are being done when they don't need to. The studies show that these surgeries often do not come out very well, and that if we do a sham surgery, like a fake surgery on a knee, versus a real one, the results come out about the same. So why do the real one when there's a chance that it's going to cause side effects? And unfortunately, I get people that come in all the time who have had failed surgeries where they got worse, and they have infections and other things, leg length discrepancies and whatnot after joint replacements. Actually, I do want to mention that right now because a question just came in. It says hip replacement failure. So in this one, the patient said, and by the way, you can get to me by email through my website, which Nita mentioned, which is www.lastemcells.com. And every page has a spot to email me. So this person used the website to send an email to me and said he ended up having a hip replacement, but that surgery did not go well as he had hoped. He said that his right leg is 7/8 of an inch shorter than his left leg now, and the surgery has caused back pain issues. So I hear this very frequently. It doesn't mean that if you have a hip replacement, you're going to end up like this. but I hear it all too frequently, so there's a high risk of that. And the person's surgery didn't work, and they ended up with a leg shorter than the other. It's very tough working on a joint replacement to get things lined up properly because the person's asleep and not standing up. And it's hard when the body is relaxed like that to have the leg lengths come out the same. Even with the best of surgeons, I see this happen. So it's very tough. It's very tough to go through these surgeries. And we now have platelets, which is called PRP, platelet-rich plasma, and stem cells, which can often heal up the arthritis in these joints. I don't care which joint it is. I treat everywhere from the neck down the back, and the shoulders, elbows, wrists, fingers. A lot of people have hand pain and hand arthritis. And then down to the hip joint and down the legs and into the knees and the ankles and the feet, toes, you name it. So I inject all over the body and take care of a lot of sports injuries and a lot of people just getting older and having arthritis or things that are wearing down. The biggest thing we see with wearing down is what's called tendinosis. We used to call it tendinitis, thinking it was just inflammation. But after a period of time, when you overuse some part of your body, the itis, which means inflammation, turns into osis, which means wearing down. And that can last for, I've seen people with 50 years of back pain. We actually had a friend of mine, Mark Holmes, Dr. Holmes, call in the show, I think it was last week, talking about 50 years of back pain, which was cured by me doing PRP on his back. And Mark is a very tough, strong athlete, and he suffered, from surfing and doing weightlifting and all kinds of things for 50 years. I just talked to him yesterday. His back pain is still gone after doing PRP. So it's a very easy procedure. You walk into the office, you have your blood drawn, we spin it, and then we inject it, and you walk out. It's very simple. I've injected myself, as all you listeners who know me know, all my patients know. I've injected so many parts of my body, including both of my shoulders. I did that with stem cells and platelets, both of my knees, both of my elbows, my wrist. I've had other docs inject my neck and back because I really can't reach there too easily. And I would if I could, but that would be kind of dangerous, so I don't do that. But whenever I tweak myself, and I do sports kind of hard. Whatever I do intensely and repetitively, and I pay the consequences of having pain. And if something doesn't go away, then I just inject it. And I've had great luck injecting for over 20 years my own body. So even after a failed surgery on my shoulder, which came out terrible, I had a swollen arm and fever after that surgery. I didn't blame my surgeon because it just, it's like what happens after a lot of surgeries. It's not the surgeon's fault. It's just kind of what happens. And he was my professor in medical school, and I loved the guy. I never blamed him 1 second. It just, it's one of the casualties of surgery. So I learned about regenerative medicine later, a few years later, and I injected my own shoulder, and it was completely 100% full range of motion and pain-free the next morning. That's not common. I have to tell you that. I think that was, if you want to call it, the spirit knocking on my door saying this is the kind of work you're going to be doing. Because I was so excited, I started experimenting, you might say, on my patients. I'd ask them, I say, there's this new thing that healed me that I did on myself. Can I try it on you? And most people said yes because they didn't want surgery or steroid shots. They were sick of all of that. And many of my patients have already had the failed surgery and the failed cortisone shots, and they're looking for something different. They're looking for the alternative. Thank goodness this work in regenerative medicine is becoming more of the standard today. I've been teaching it at UCLA for over 20 years, and other doctors are teaching it at universities, so the residents coming out hit the ground running and are doing regenerative medicine, which we like a lot better than surgery. I mean, God bless the surgeons. They've got tough jobs, but and sometimes surgery has to be done. If I get someone who comes in with a joint that just doesn't move or has been smashed in an accident or something like that, I send them right to the surgeon. But most cases I can help myself. And we do it just with simple injections, and the patient can drive home themselves and walk out the door. So, the first thing in medicine is do no harm. That's the first law of medicine. So be conservative. Try the things that aren't going to hurt you. And regenerative medicine is generally one of those. It's very tough to hurt somebody by just injecting them. And the injections are done with your own cells. It's very simple. So that's what I've been doing for years, and it's something I hopefully will be able to continue to do till the day that I leave the planet. And that's a nice thing about it, too. I expect to be doing this kind of work, in the, quote, forever stage of my life. It's pretty easy to do. I don't know why more doctors are not learning it. It's becoming the trend, but the surgeons still hang on to the knife, and I don't know why. There's so many people that I send, so many of my patients I send to surgeons for a second opinion, just so the patient can have informed consent. And the surgeons generally tell them that they need to have a surgery, and the patient refuses, comes back to me, and we get them healed up. So yes, we would like your calls, and the number to the studio right now, if you want to write this down, is, I'll repeat it a couple of times, the studio number to talk to me personally is 866-870-5752. I'll repeat it while you grab your pens and pencils. It's 866-870-5752. Please call me now. I would love to talk to you. And if you're shy, use a fake name. You don't have to say it's about you. We can talk about your family, your friends, or whatever it is. Even if it is about you, we can disguise you. Also, if you want to get to my office to get more details, specific details about you that we don't cover on the radio, you can call the office at 800-300-9300. We do have people waiting by the phones right now. That's 800-300-9300 to my office. So, Nita, I hear you breathing. You must have something you want to tell us.
Well, I do. I want to remind you to call Dr. Darrow. This is your opportunity to feel better if you've been in chronic pain for a long time. 866-870-5752. 866-870-5752. And check out the website, www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, as well as watch him performing the treatments on videos. Would you like to talk to Charlotte?
Why not? Charlotte, hello.
Hi, Charlotte. Are you with us? Charlotte
we can
has
put
a
her
need.
on hold, and we can put her on hold and go to Blossom if you like. Okay. Blossom, are you with us?
She's not quite with us yet.
Oh, she's not ready, yeah.
She's not ready, but we'll see. Let's see.
How about Charlotte? Are you back yet?
Let me see.